Good afternoon, everybody. So, part two today, we're going to go over fact sheets and infographics. And so, Lynn Davey is going to share all of her knowledge, and we can't wait to see how she's going to improve how we see fact sheets and infographics within injury prevention. So, Lynn, take it away.
Thank you, Stephanie, and thanks to everybody for taking time again today to join us. So what I want to do today is really have this as interactive as possible. We're going to look at fact sheets and infographics today, and then tomorrow we're going to do something similar with social media. So I'm going to sort of go through what the structure should be, and then we can talk about content. We're going to look at lots of examples and just tear them apart. And then at the end, we're going to build one ourselves with just sort of the key elements, so everybody can have sort of a good idea of what to do. So let's just dive in. I think, we all interact with infographics a lot, right? And a lot of times it's just clutter that we see. They don't often have stories. Sometimes they can be really wonky. There's a lot of data. They're problem oriented, and so I want to sort of go from those to something that, if you see here, the center is really the story, right? What is the story we're trying to tell, and who are we trying to tell the story to? What information do they need? How can we make it relatable? So I'm not going to spend much time on the actual design, how it should all be sort of ordered. There's tons of stuff you can find online, and I'm at the end, I'm going to give you some data visualization resources that I rely on, and sort of design resources that I rely on. And you are going to have a handout of all of these, or most of these slides, so that you don't have to worry about taking notes or doing screenshot after screenshot and cluttering your own desktop. So why do we even do infographics? What are we trying to do? Well, the only reason you should do one is because you need to inform somebody of something. And this sort of, 1 or 2 pages could be a really good way to do it. So a lot of times clients come to me, and this is probably more true of social media, which we'll talk about tomorrow. And they just say, well, we need a social media strategy, but they have like 7 followers. So I'm like, well, is that really the way that you're going to reach the most people? Like, what else are you doing? So asking yourself this question first, why are we doing one? Who do you have to inform of what and why? And those should really be the key questions. If they're professional groups, other, researchers and whatnot, here's an example of what I think is a really appropriate fact sheet on the sexual abuse of children, which is from Prevent Child Abuse America. So this is a lot of text, right? But this is a fact sheet, and it's actually 3 pages. So they start with, what is it? How common is it? Who are the victims? Who are the perpetrators? What are the signs? What can be done? And they end with a list of their sources so that people have more information and some sort of acknowledgement. So, this is the kind of thing that I think the answer to their question is, we want to give people in this space, right, who need to know about it and who might confront this, the sort of basics. What is it? How common is it? And that this could be just, a fact sheet that you have at the ready on your desktop or on your shelf. So that's a totally appropriate kind of fact sheet, even though it is really text heavy. What about policymakers? What if you're pushing legislation? I have some clients in New Hampshire in the early childhood field, and they designed a template for, and anytime they're going to do a bill, lobby up for a particular bill. I know a lot of people can't lobby, but if you're doing advocacy, you could just take the bill number out of this. And this is their sort of template. So they have the bill number at the top and what it's called. This is an early learning bill to support our workforce, to build the Granite State's workforce of tomorrow. Then they have just a vision summary, right? We talked last time about starting our communications with values. In New Hampshire, we take seriously our role as stewards of the next generation. That's a big, building a big tent with a vision value statement. Then they have a little background, All right, there have been these federal rule changes, and this bill in our state is going to be designed to do this, and this is the impact. Then there's a little summary at the bottom of the bill, and they end again with, this kind of visionary statement for the bill. 1 page, lawmakers want bullet points, and this could be even, a lot for some lawmakers to digest if it's going to end up on their desks. So, bullet points and as clear information as you can. The other thing is, even though there's a lot of text on here, they used color at the top, like it's very readable. Your eye goes to it and so you sort of know what's happening, right? It's a kind of a script that's identifiable. So those are sort of the ideas of fact sheets, right? We're going to move more towards the infographic. And let's talk about the structure of it first, and then we can talk about framing the actual content of it. What do we say and how do we say it? So I love this little diagram that's from Easly, which is, sort of like Canva, but they have lots of templates for infographics, and I would recommend checking those out. What does this look like? It looks like the term papers that we wrote in high school, right? You have your title or your topic, a beginning, which is a little bit of a summary, a little introduction, then the middle where you have a lot of examples where you're going to put your data, you're going to build out your argument as much as you can in the space that you have, and then the end, which summarizes it. So this doesn't have to be complicated. I know a lot of times we will go to places like Canva or Easly and it's just some template and we're trying to punch things into it. Instead, what I tell people to do is sketch out on a piece of paper the idea of your infographic. I can't draw anything beyond a stick figure, and even those look a little wonky, but I still do that first. And I also do it with presentations before I go into Keynote or PowerPoint. I'm like, what do I want to say? How do I want to say it? What's the order going to be? So just sketching it out on a piece of paper is a really great way to start. That's what they did here, right? It's got the title, it's got the summary, it's got the background information, and then a little bit more about the bill summary and ending, and then a sort of call to action. Let's look at this one. This is from the Connecticut Department of Public Health. It's on suicide, right? A public health problem. When you see this, I'm going to zoom in on different parts of it so that you can read it a little easier if you're on a small laptop like I am, or maybe an iPad. What comes to mind when you first look at this? Do you think this is easy to digest? Not so much. Feel free to unmute yourself. I know there are suicide prevention folks who are in the first workshop. Maybe you're here as well. You could type in the chat. How is this following the structure?
It's not easy to digest, but it will be like understandable if you're in a public health space. But if you're not in a public health space, but you still want to learn about suicide prevention, then it's not easy to digest.
Right. So, the first thing is, who do you have to tell the story to, right? And, I'm not sure. I'm just using these as illustrative, right? I'm not sure who this was for, where they handed it out, but it was on their website. So anybody could really have access to it. Other thoughts?
It's very wordy. There's a lot of words.
Lots
that
of words.
doesn't make it very enticing to want to read.
I know, right? I know, just the amount of information that we're presented with, it's like, could you help me out a little bit? Could you make this a little bit more attractive?
Absolutely.
It does, at the bottom, 24 hours a day, here are some resources, but I'm not sure how much of this would be new information even to people in the public health space or working on this. And if this was going to be a poster somewhere, it's probably, I'm not sure what it's doing. Other thoughts?
In the chat, Jeanette Foreman says it needs headers or sections so people can jump to the content they want. I agree.
Exactly. So that's what the PCA America sexual abuse one had, right? It was like, what is this? What's the incidence? Blah, 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 blah. You know, having headers is another great example. A great strategy, rather. The other thing that this does a lot of, and I know experts, well, all of us do this, is we just list stuff. Okay, so stressful events, alcohol, substance abuse, impulsive tendencies, and lists aren't frames, right? It's just dumping information at people. And infographics and fact sheets shouldn't just be dumping information at people and dumping facts, but trying to tell a story. This is from the CDC. So a sort of blanket kind of one-page fact sheet on state injury and violence prevention programs. What do you see here?
It's very monochromatic.
It is monochromatic. I think they're trying to break it up a little bit at the bottom, but
There's a graph or a pie chart, I should say. So that's something interesting other than words.
I was going to say
What-
it's colorful. You know, the colors are real gentle. It's very appealing. I love the reality, the cost, the pie chart, the picture.
yeah, there is a lot of white space, and there is, you know, there's a happy kid with a helmet, which is better than a kid like falling off his bike without a helmet, because you want your visuals to be, you know, frame adjacent and frame reinforcing. One thing I want to say about a pie chart is, unless there are 2 or 3 pieces of pie, do not use a pie chart. I am on a mission to replace bar charts with pie charts if there are more than 2 or 3 pieces. And that is because people can't, and I don't know if let me see if no, I didn't blow this one up. I think I'm going to talk about it a little bit later, but when you do pie charts, have the biggest piece of the pie at the 12 o'clock going to 3 or 6, like going clockwise. And so you should order them from biggest to smallest. So this is, you know, this is one of the problems with this, is that the other category is 24%. It's actually the biggest piece of the pie. And they are trying to draw attention to, I think, firearms, gunshot. It's the darkest blue, but usually darker colors signify to people, at least who are used to looking at charts, more of something, right? So usually the biggest piece of the pie should be darkest and then going to lightest, or it could be the other way around, depending on how you want the sort of balance to read.
So
One other thing.
I'm
Go
so
ahead.
sorry, Lynn. Excuse me. Elizabeth Otwell said that, and I agree with her, is that she likes how the takeaways are in separate boxes, so you can kind of see like what information is being stated. And it's not just a bunch of words.
Yeah. Thank you. Great point. One thing that I have trouble with is the cost thing, right? So remember how we talked last time that personal attributions of responsibility tend to be the default way that we make sense of people's behavior. In injury and violence, that's an enormous problem. So I think you need to frame in ways that don't make it sound like these people who are being irresponsible are costing all of us billions of dollars, right? If you can point to structural solutions that would reduce these costs, I think that could be a better way to go. Otherwise, also, it's like huge numbers, right? Like, how is this costing that much? I don't know if everybody, you know, can really make sense of that. Okay, let's move on. So how do we frame fact sheets and infographics? Well, it's the same as framing anything. So you want to appeal to shared collective values. You want to try to describe themes and not events. I know that gets difficult when we're using data that tends to be very episodic or individualistic in some cases. Pointing to solutions And then, you know, being positive and constructive, not fear-based, using humor. And, you know, that is one thing. This seems sort of, you know, they've got this happy kid here. It's not scary to look at. I agree with the color palette is inviting and sort of soothing. So, and they do have, you know, an example, at least one example, violence prevention efforts such as home visitation, et cetera, you know, can save lives. I think it would, most people don't know what home visiting is, so it might help to explain what that is and how it can save lives as well. So how do we, was there a question? Okay, just a mute issue. So let's just focus on the story you tell, right? These are the 4 sort of key elements of a frame. Telling people why this matters, what the big idea is, what's the problem, how's it solved, and who's responsible for solving it. So that should really, you know, go into your fact sheet and infographic as well. So let's analyze some infographics. I want you to think now, just not so much about order and white space and headings and that sort of thing, but what is the infographic saying to you about why this is an issue at all? And what's the problem and how it's solved? And certainly any other thoughts that you have on design elements, feel free to share. So this was many years ago, a client of mine in New Hampshire, a health equity partnership, excuse me, produced this fact sheet. So I'll just have you kind of take it in as a whole, and I'm curious what your thoughts are. It's called Closing the Gap. It's got a title. Does it have a beginning, middle, end?
There's a lot going on here.
There's a lot going on. Let me zoom in on the top half of it so you can see that. What about the colors? I told you not to focus on design elements as much this time, but I can't get over the colors, right? It's dark. And on the left here, you've got red on red background. So I don't know about you, but my eyes automatically jump to the data in the green background part because it was just sort of more, it was easier to read. So closing the gap, we don't know what the gap is necessarily, right? And how it affects you. Does it affect me? Okay, there's a problem. Let's state what the problem is. That's a good idea. Not everyone in New Hampshire has the same opportunity for good health. This creates a health gap. People have different health outcomes, creating a missed opportunity in one of the healthiest states in the country. Do you know more about what the problem is from this problem statement?
Not really. I mean, people have different health outcomes. What on earth does that mean?
Right. So if you look at the data, then it says the problem affects everybody. Health disparities are a shared problem. They impact everyone through our quality of life and the cost of things, right? So now it sounds like, oh, people with bad health outcomes are costing me. So if you look at the data, minority women in New Hampshire are 3 times more likely to have cardiovascular disease compared with white women. Minority men in New Hampshire are almost twice as likely as white men to have diabetes. Now, this is one of the whitest states in America, right? So if you're just reading this and you don't know anything about health really individualizes, right? You've got your genes and your good fortune or not. And so a lot of people look at health disparities and blame the people who are portrayed by the data for having them. So they start asking questions, personal attributions. Oh, are they not going to the doctor as much, or, you know, whatever it is? Are they eating poorly? Are they not exercising enough? And then it goes on to talk again about costs, right? 30% of US direct medical costs for Blacks, Hispanics, and Asians were avoidable. The economy is losing money. So I don't really think this is telling us a story about what's causing it. What is the real problem? You know, and how do we solve it, and how does it affect me? I like the we can work together to solve it. But also Elizabeth wrote in the chat, red and green are bad for colorblind, right? They can't distinguish red and green with certain kinds of color blindness. And Lisa's saying the clinical and public health jargon are almost unreadable. It's true. You know, I do like this piece of data on minority youth. That's telling us something structural happening, right? That 3 times more likely to be absent from school because they feel unsafe. What is going on? And they try to get some social determinants of health in here. Good health doesn't begin with a visit to the doctor's office, but starts in our homes, schools, and communities. But if I'm coming across this infographic, I'm not really sure what I should do. Are you? Not so much, right?
It's pretty deceiving for me, honestly, because when I first looked at it, I'm like, okay, this is a good one. And I like how on the left there was actually a kind of like a flow. Like there's a problem, the problem affects everyone. We can work together. But then once my eyes started to zone into the boxes on the left, I'm like, wait a minute, it's kind of vague. And then I kept getting distracted by all of the statistics on the right. So yeah, now that I look at it some more, I don't think so. But at first I was like, wait a minute, we got something here. So I like that. I like how it kind of deceived me a little bit.
Yeah, I really like your observation. And the good health does not begin with a visit to the doctor's office. Why didn't they use that up at the top, right? And I see in the chat, Jeanette is saying the same thing. I really like the phrase on the bottom right. Yeah, that's an orienting vision phrase, right? So
That seems like it should be first.
it should be first. Yep.
I mean, it's a
Definitely.
value, you know, it's a general value. We all value good health.
Right.
Like it's very informative, but it may seem kind of overbearing for the casual reader.
Yeah. Yeah. I mean, your eyes are sort of darting around like all this pileup of negative statistics, right? So I'm going to show you a little bit later how we fixed it, but not yet. Again, I point out, just remember that personal attributions are the default inference people are going to make. So when you're thinking about what data to have in our fact sheets, like as much as you can explain it and contextualize it, the better off we're going to be. So I was talking to a client yesterday about who wanted to report 3rd grade reading and math assessments disaggregated by race. When I'm like, okay, that's fine, but we can't just report that. And also by economic disadvantage, because all of the Black, brown, and poor kids in this state did worse. And so I said, well, we also need to have data on, you know, are the schools that these kids are in, are the teaching and staff representative of the population of the students who are there? Could they be called culturally effective organizations? Are they in communities that have a history of disinvestment? You know, how do you explain the data that don't make it so that people are going to attribute responsibility just to those kids and their families? Does that make sense? Okay, that's some thumbs up and nodding. Okay. Here's a fact sheet from the CDC for parents on brain injury, on concussion specifically. And so it's a 2-pager. I just put them side by side, so front and back. And I think, you know, sort of taking it in as a whole, they do a really good job of the white space and the colors and the readability and the headers. So here's the first page. What do you think about this as a fact sheet?
At least you know like who it's for. It's for parents, because at the top it says a fact sheet for parents. So that's helpful to know who it's for. And
Yeah,
what
it would be great if it were like delivered to all parents whose kids are in a rec program or on an athletic team or whatever. Lindy, did you want to say?
Yeah, my first response is why is that second paragraph even there if they've got a chart down below?
Yeah. Someone else wanted to say?
The image, I like the layout, but the image could be a child that's an athlete, like you were mentioning, or someone in sports, like a parent figure with a child that is more prone to probably getting a concussion. This looks like a tutoring session or helping his daughter with homework.
Yeah, and it's not like they're not tying the picture to anything that they're saying here, right? It's like if your kid is struggling with finishing homework or, you know, so it seems, yeah, like it doesn't make much sense.
I think also because it does affect your emotional and social health. You don't always have to be playing a sport to get a concussion. And so if we have like a picture of, even though it's called Heads Up, and it's most directly tied to sports, because I did receive this as a coach when I was a teacher in like a packet from the CDC, but kids still would get concussions, not from sports. So
Playing in the yard. Yep.
Mhm.
Yeah. In general, I think it's really well done. You know, it has a lot of information. Okay, so before you craft any communication, you want to ask yourself, what's the story? What is the story I need to tell and to whom? And then what data do we have to support that story? So I think especially with a lot of fact sheets, infographics, data, online data and tools, we just think, what do we have? Like, what do we have at what level, at what geography, for what ages, on what, you know, what time periods, and how can we put it all together to get as much data up there as possible? And I just want to sort of always forefront the story and the explanation that you're trying to tell people. Like the goal should be to make people smarter about the issue. That's, I think, why, you know, why we should be communicating at all. And then don't let creative design ruin the story. It's not about dressing up, it's about communicating. So, and not all designers, I work with one designer almost exclusively, and I have to tell her, you know, how I want my data visualizations to go. Otherwise, they'll look really pretty, but they might not communicate terribly effectively. So, which of these would you recommend using? I'm going to show you 2 executions of data in chart form. And I'm just curious which one, if a client was asking you to do a chart and you created these 2, which one would you put forward? So graph A is on the top. I know they look like they're one infographic, but graph A is on the top, or graph B. So the graph is the top 5 active Twitter moments among different happenings. How many people, you can use the chat and just type in whether you would vote for graph A or graph B.
we have graph A, yes, everybody's saying A. Ooh, 11 to, ooh, somebody said B. Okay. I would love to hear why A and B.
Okay, sorry, I was looking at my notes on something. Okay, do we have just one B?
Yeah, it's just one B. I
All
like.
right, Nicole Burnside, you
Yeah.
have to unmute and explain yourself.
You don't.
So
know.
I like the design more of B. It said the top 5 moments, and the one in A, I was like the white words, I kind of got stuck there trying to see what they said. The B was a little confusing, but I still like B better than
So
A.
you are in alignment with the folks here from Smashing Magazine who wrote in the blog that, you know, if your client just needed an Excel chart, they wouldn't hire you, and that graph B would make the client happier. But I like you, I like you're drawn into it because of the design, right? But I'm not sure, I think I might fall with the A people that I'm not sure I come away from graph B actually knowing what, so somebody who picked graph A, and Nicole, you make a great point here about the white type is, and again, I sort of expanded this hoping we could all see it, so it might be blurry because of me, but the white type can be hard unless it's on a really dark background. So who chose A and why?
I chose A because the numbers on graph B confused me. And on A, it was like a simple XY graph. Pretty much everyone knows how to read that type of graph. So it would be more appealing to most of the population.
Yeah, I mean, for me, I immediately knew that the Women's World Cup final was the top. And when I'm looking at the bottom one, I think it could also be because the background of the meter is this, uses the same colors as the whatever the arms are. And so I just had a hard time, like my eye goes up and I think the thing that's closest to 3600 should be the top. You know what I mean? So it can be confusing, but you know, I think what's great about this is playing with different design elements and also knowing who, again, you know, knowing who your audience is. And I didn't catch who was just speaking, but to the point of like, most people are really familiar with XY, so they can probably deduce what's going on there. And Elizabeth is saying kind of what I said in the chat there. I knew immediately which one was more. The bottom one took a little bit more time. All right, so these are just, you know, these are the kinds of things that we have to, what's our story and how can we get it across, right? The biggest obstacle to communicating data is really a failure to translate, not explaining the meaning of the data. And I know a lot of times with researchers and public health folks, you don't want to come across as if you're pushing for a particular policy or programmatic solution, but you can explain what the data mean, right? And also, you know, we often use data that reinforce personal attributions of responsibility. Like I was saying with my client who wants to put the third grade assessments up there and without any other data. I'm like, I'm kind of worried about this thing. So here's something from actually Kids Count. I think I took this from a Colorado fact sheet. This is very typical. Do you think this is effective? So it's got, okay, Colorado ranked 21st. That's what the 21 means. In family and community indicators, Kids Count is a, I don't know if everybody's familiar, but there's a national book that ranks all of the states on a number of core indicators that all the states collect, that are collected similarly. What do you think about this? So Katrina's asking, so what? Yeah, what am I supposed to do about it? Yeah, exactly, right? Other thoughts?
I think some of it is effective, but the bottom portion, like for the first one with the 356,000 children worsened, that part is a little bit more where I would need some explanation for. But the top part, the 30% and up, I'm like, okay, that makes sense if I was just looking at it from a glance.
Yeah, it's like, okay, children in single parent families, 30% in 2012. Is that 356,000 children, or does that go with worsened? And why is 2005 and 27% over there? Is that how it's worsened? Is that the number it's worsened by? Is that the number of kids? Yeah, but other ideas. Let me open the chat again. It seems, yes, thank you, Lisa. It seems to blame single parent families right out of the gate. Why are we reporting the number of children in single parent families? Why is that in the same category of indicators as teen births? Why is teen births not in health? What does family and community mean? Like, what are we saying about family and community with these 4 indicators? That's really my question.
It needs to be more
mean-
of an ecological model. I mean, this is really about, especially the single family or single parent families, that's really a proxy indicator. And I'm sure that's someplace in the limitations.
Yeah. Children in single parent families is only and sometimes an indicator of family economic. It's a family economic indicator, but this sort of, right, it's so fraught with stereotypes in our culture that I don't know what we're doing when we report it like this. And Sidani is asking, yes, is that a personal attribution of responsibility? That's the problem with this, right? And this is the thing about, I have a long background in data and social indicators. So many of them are these sort of deficit, individualistic indicators. We report poverty data without also talking about inflation or consumer price index or things like that. So the kinds of stories that those data cue, tend to be personal. Last time I focused a lot on transportation, and then I knew that a lot of folks were from other areas of injury prevention. So I'm trying to give a bit of a wider net today when we're looking at things, but we're going to go back to distracted driving for a minute. What are your thoughts about this infographic? There's a title, sort of. Is there an introduction? No, right? So then you have to just deal with the data. How do you read it? Left to right, up, down? Like, our eyes usually go left to right, but this is just sort of all in front of us at once, right?
I would need these to be equal. It's bothering me that they're not equal.
Oh, this? Yeah. I know.
And the bottom is just kind of smashed down there. Like,
Yeah. If you see this, what's your takeaway? What do you remember?
to be honest, I look at the largest number first. The 24,611 crashes in 2018. But compared to what and when, and there's probably like a smaller thing at the bottom, but it's nice.
Yeah, the fine print.
Yeah, too many numbers, Lisa Dawson said. Too many numbers, probably a different color than the chartreuse green-ish color.
Yeah, I get that distracted driving is a problem and there's lots of numbers around it. And seatbelts are helpful. But nothing about distracted driving. Like, how do you stop the actual problem? I don't know. It's a problem and it's killed some people, but I mean.
Yeah, we keep getting into these conversations everywhere and in legislatures around the country. When this comes up, it's just, well, you're never going to stop people from looking at their phone. Well, have we told people what else they could do? Like, here, put the phone in the back seat or whatever, so, but there's nothing. It's just, it's got white space. It's got nice images that match the data, but there's no story, right? There's no beginning, middle, or an end. This one I found interesting from AAA. Again, it's blurry because of me, not because of it, but 6 out of 10 teen crashes involve driver distraction. 15%, just one thing, they're using when you use red, orange, yellow, then green. Again, this is not a colorblind palette, which you should always use. But whenever you use red and orange and yellow, people think bad and think warning. So just, you should kind of be aware of that when those are color choices, especially if they're next to greens. Let's see in the chat, 2 seatbelt items and teen auto deaths timing take away from the distracted driving theme. Yeah, the other thing is 9% looking at something outside the vehicle. I thought that was sort of funny. Like, isn't that driving? Is that what we're doing when we're driving? I know they're talking about something else. Like you distracted by something outside the vehicle. And also the 2 6% are different colors. Why, why is that? So again, they appear to have driving tips, but you have to go to the URL. So not really helpful. I found this is actually from a personal injury prevention lawyer on the Hands-Free Georgia Act. And I just want to call attention to something again. So it's really, it's dark. I don't think it's, the white type on really dark can be difficult, but there's at least this, here's a summary of the new law. And then it says, don't hold your phone, while driving. It's got a hand, but then do use hand-free and it's got a phone, right? And we usually hold a phone there. So again, always making sure just even the icons that we use are frame reinforcing. And in the chat here, show what we don't want to see versus positive messaging, illustrating prevention strategy. Okay, great. Yes. I found these really interesting. So this is from a group, now I'm getting their name wrong, the Family Youth Institute, but they do lots of research in injury and other things. And they target their work in Muslim communities. So these are very specific to Muslim communities and would be, the idea would be to put these up in community centers and mosques and that sort of thing. So these are on suicide prevention and intervention. Let's just look at the suicide intervention one. If someone is suicidal, do you know what to do? Suicide intervention. Stay calm, listen, do not preach, assess the situation, assess risk. And then they also include protective factors, which I thought was great. What do you think about this? I'll go to the second so you can see the bottom as well. Ask about self-harm plans. If they say yes, do this. If unsure, do that. If no, and then here's how to act. What do you think about this as an infographic?
This is Ursula. Well, honestly, the image number 2, it's just it's confusing to me. It took a minute to figure out what it actually was. And image number 3, maybe it's because I'm a nurse, but it looks like someone's sitting on the toilet.
Yep. Didn't even think about that. Yep.
Right.
But
must be the nurse in me.
No, but hey, right? So but I also, Ursula, had that thing. I'm like, wait, am I listening or am I in the thought bubble? Like, right? You don't know how to, wait, who's listening and who's preaching and who's shushing? Yeah.
Right. Yeah. Or am I telling the other person to stay calm, or wait, I'm supposed to stay calm and then do all these things. So I find it confusing that the content below that, I like.
Yeah. So maybe the top could have been, maybe not even use the word suicide intervention, but if someone is suicidal, do you know what to do? And then go, you stay calm, you listen, and then you assess, and here's how. Yeah. It's easy to read, someone says. I love that it's familiar words. Yes, briefly saw the SeaWorld logo. Okay. We have to be careful of what the iconography is going to signal to people. Yeah. But I thought this was nice. And then it's hopeful for a very difficult conversation. And then it is showing, here are some additional resources that we have and where you can go. Okay, I want to be conscious of time, so we're going to move along a little bit. So you remember this infographic? I'm going to show you how we changed it. We changed it to this. which was creating pathways to health in New Hampshire, and used so the whole sort of metaphor is about pathways and removing barriers and opening opportunity. And so I'm sure you'll be familiar with the sort of sun there that is all the social determinants of health. And we took that phrase that some people said they liked, good health starts in our community, schools, and homes. Actually, it said homes, schools, and communities. We flipped it to be communities first, to be as contextual as possible. We had a little health is central to opportunity there. I know it's a little hard to read in this text. And they wanted to focus instead on inequities in educational attainment and income, to just take from their real public-facing posters and infographics the racial disparities out of the conversation until they had sort of people in a room. So it has you can see it has a different feel, right? Working together on innovative solutions to find out what you can do. Here's more information. The challenge of data on disparities, I think I've intimated this a little bit, but I found this example just short and really helpful from a colleague of mine, Dr. Joanna Schaffner-Scott, who has a Race in the Workplace blog and is helps organizations with equity. And this was during these were COVID data that she pointed out. This was in the Baltimore Sun. In Maryland, 49.4% of those infected whose race was known were Black, 36.9% were white, 13.7% were Asian, et cetera, et cetera. So there's no frame. It's just a data dump. And she points out when we don't offer a frame for data, the reader's going to add their own, right? And the reader's frame is usually a deficiency in people. In this example, Black people. Why are they 49.4% of those infected? Unframed data primes and reinforces stereotypes that the reader already has. So she says, offer more context. What you could say is Maryland, like most states, has a history of place-based racial and economic segregation that influences where people work, how and where they access healthcare, and discrimination in healthcare settings. All of these influence the racial differences in the COVID-19 related data. And then you add the data to follow up and add more context, but don't expect people to connect the dots that you have in your head about this stuff unless you put it on the page. I'm going to skip along. Maybe I'll share some of this tomorrow, but let me just show you this one. This is the same client who, as the infographic, was curious that the foreign-born population in New Hampshire was of prime working age. So they put this simple chart, we can all make it in Excel, out there, right? I'm like, well, nobody's eyes are really drawn to what you're saying, and you don't have a descriptive title. You just, right? We just put the census data up there or whatever. So we just changed it to this. The foreign-born population in New Hampshire is concentrated in prime working ages of 25 to 44. We focus attention on that, and we fade out the other data. So another key when you're doing data and charts is to use color to communicate something, right? So you can just use no color across. We could have used no color across this, just shades of gray, except for this one data point. So that's another thing to think about. Oh, that's the pie chart that I already talked about. And so some data viz resources, these are going to be in the handout. I have this set of chart chooser cards. So, and I can actually show you what these are because my screen is actually open. So they're the stack of cards that I have. And actually you can see, sorry, wrong one. That's Anne's thing. I was going to show you that. Okay. So they're a stack of cards, and what they say, they have these things like, what do you have to do? Do you have to compare things? Do you have to show things over time? And so they're like, if you compare things, there's 5 green cards that show you all the different charts you can use to compare things. Changes over time are purple, and 5 charts. The other thing they have is Excel and Tableau templates that you can download, so that if you need to do a donut chart, they have the Excel file. So I have the infographic on my wall at work. It looks like this. And here over on the left, this is the card deck. Isn't that cool? So it has all the examples of the different charts. And then over here is the Excel and Tableau templates that you can then just use yourself. And then there's also this wonderful woman, Anne Emery, who does just data visualization. She has an interactive chart chooser guide on her website where, you know, if you want to do, where's a good one that we all do, pies and donuts or bars, then you click on more. And there are all these examples. Here are some resources. Here's a tutorial, blah, 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 blah. So both of these links are going to be in the handout that you have, and I really recommend them. These are the books I point to a lot of, mostly Stephanie Evergreen, Effective Data Visualization, and most of it is in Excel. And then Cole Knaflick on storytelling with data, and she does workshops and as well. I won't go through all of these, but this is all going to be in the handout that you have. And I'm going to move along because we're running out of time. I want to build one together. Okay. Since we have about 10 minutes. Do we have 10 minutes? Yeah. All right. The key steps to building an infographic. This is from the same woman who did the structure. Create an outline. What's your question? You know, sketch this out. Then you design it, sketch it out. And then you ensure the quality of the data and everything that you're using. So let's just think back about the structure, the title, the beginning, the middle, the end, and we're going to do that together. We're going to create one with a title, a beginning, a middle, and an end. So our infographic, our audience is service providers, health providers who we want to educate about resources for children and youth who've been exposed to violence. Okay, that's what we want to do. That's the story we want to tell. So here we're going to go through the different pieces of the infographic. Which do you choose to tell the story? Title 1, option 1 for the title: the effects of exposure to violence during childhood and young adulthood. Option number 2 for the title: creating pathways to well-being for children and youth exposed to violence. You can use the chat to vote. So it looks like everyone's choosing 2, which is great. That's what I wanted you to choose. Why didn't you choose 1? You're all being shy now.
It's negative focus.
Right. And it doesn't say anything, right? It says what's going to be contained, but it doesn't give you any sort of optimistic look, right? Negative framing. We know that violence is bad, but this signals solution as well, right? And that's another idea with the title is, can our title signal solution? Okay. Next piece is the beginning, our little summary at the top. Violence frightens children and makes their world feel unsafe and insecure. Exposure to violence can harm children's development unless they receive support to help them cope and heal. Or 2, exposure to violence, especially when it's ongoing, can produce toxic levels of stress, which can harm development during childhood and into adolescence. But supportive, stable relationships with caring adults can buffer this toxic stress, even reversing its effects. 1, 2, what's your vote? There's not a ton of difference, right? Okay, Lisa Dawson, want to talk about why 1?
I think I think the toxic levels of stress and harming development, starting to talk about adolescence. The words have gotten probably beyond 8th grade in beginning to, and also I'm trying to invite them in. So I want people to read further. So I want to go shorter. I'm trying to invite them in to say, oh yeah, I agree. Violence is the worst. But gee, what do you mean it can harm somebody's development? Like I want them to ask that question.
Okay.
So littler bites, I guess, is why I was thinking that. I mean, I like to, but yeah.
And folks, anybody who chose 2, you want to say why? Oh, my old friend Jill Walsh is here. Jill, can you unmute and tell me why you chose 2?
I'm not Jill, I'm her intern using her link.
Oh,
But I chose 2 because for the exact opposite reason. I thought 1 was elementary and I already knew like violence. I feel like most people know violence frightens children, and I feel like most of that's common knowledge. But 2, it gives, somewhat of more detail and information regarding about what I'm assuming the rest of this infographic is going to be about.
great. Thank you. I think, and folks who are also writing in the chat, it's like, who wrote the number 1? Jeanette said 1 is simpler for the beginning, maybe 2 is later on. It sort of depends on your audience, right? So our audience are going to be, health and service professionals who might be interacting with kids. My idea was 2, but I really like everything that Lisa said about the simplicity. So maybe we could meet somewhere in the middle and kind of simplify it while also giving some more information about how violence actually impacts kids and having a solution that's pointed to there. Oh, it's not just if they receive support to help them heal, but supportive, stable relationships with caring adults can help them heal, right? So, okay. Which data do we choose to include? We've got child abuse and neglect statistics, incidence rates of bullying in schools, of sexual violence in young people, percent of schools with violence prevention programs, ratios of mental health providers to the population, all of the above, none of the above, something else. It's hard, right? So I think that what we tend to do is, child abuse and neglect statistics or the rates of bullying or this and that. And we decontextualize that from things like programmatic and policy details that we could point to. So it yes, as Elizabeth is saying, it definitely depends on the audience. But what I would ask for you to do is when you put data into an infographic, make sure it's telling the story that you already started telling and isn't going to like hijack people into thinking something different. What about visuals? Here's some ideas. I see a lot of this. Stop violence, stop school violence, stop teen dating violence. What do you think of these visuals? Or do you want to see something different?
I think they're powerful, but they don't tell me how.
Yeah, they don't really, how do we stop violence? Am I supposed to stop violence? How do I do that? These are some others that I found in infographics. So the one on the upper right is actually showing an incidence of bullying, right? I would try to use, the one on the upper left is, could be suggesting that kids are in school in some sort of program. The one on the lower right is peers together. The one on the lower left, rather, the one on the lower right is some therapeutic setting, but nobody looks afraid. There's, smiling. So trying to make sure that the visuals that you choose for these things are saying something and are, frame relevant. And as Sidani's saying, yes, these tell a story. Okay, our ending. If we continue to ignore the violence our children are experiencing, we will be sacrificing our next generation to a life of mental and physical health problems. The time to act is now. We can stop violence now. Or 2, it's essential for communities to put in place strategies that we know can prevent adversity from becoming toxic. We can do better, add your voice or join us, or some sort of call to action. What do you like, 1 or 2? Yeah, and I'm thinking, my idea was that it would be 2, and I think I've seen a lot of 1, like, let's do this now. Like, here's the pileup of bad things that'll happen if we don't act now. And so if we were to just put that all together, we could call it creating pathways to well-being for children and youth exposed to violence. Then I used the number 2, but for the beginning, but we've already agreed we need to wordsmith that to be a little bit easier to handle. And then we could use data like this, only 1 in 5 schools in our county offer school-based violence prevention programs, which research indicates can reduce aggressive behavior. At the same time, BIPOC students indicate they don't feel safe at school. Like, trying to tell a story with the data. You could also say we have this other challenge. We have evidence-based clinical treatments that can help. But here in Georgia, on average, there's 1 mental health provider for every 600 Georgians. What are we going to do about that? So we have to put in place strategies that can prevent adversity. Then you could put in a solution that's connected to that data. And you don't want to write the data like that. You want to design it. I just couldn't do it in the in the PowerPoint to actually create an infographic for us here. But that's the idea, right? What's our story? How do we start it? How do we find the data that are going to support it? And then how do we put it all together? So remember, it's not just about a data or a fact dump. Find the story you want to tell, include the data that support it, and help people understand that. I have more resources on data. I've written some blog posts that you can get on my website. This QR code here I have a bunch of little YouTube videos on framing and framing bites, and there's a collection of those on data as well. So I know we're either close to time or over time.
Yeah.
I want to stop and see if there are questions.
In the chat, we do not have anything, but if you guys have any questions for Lynn, you can unmute. Or comments. Ooh.
This was really helpful. Thank you so much.
Absolutely. Thank you so much for everybody that came out today for the infographic portion. Tomorrow, come join us for the social media posting portion, and we'll continue the conversation, and maybe we'll build a social media post tomorrow. I don't know. We'll see. Lynn, thank you so
We'll build a social media post, and I promise I won't go overtime. I was convinced we could do this in an hour, but you had such great comments. So we'll have more time for that at the end tomorrow.